Hello guys, how are you all? Welcome back to the channel. You're watching Everything Reviews, and today I'm not gonna do the usual reviews. I would like to share my knowledge on coronavirus in this time of emergency, as I've been a life science graduate on working on these viruses so long. So I would like to share my knowledge. Hope this will help to some people to save others and save their lives. Hope so everyone knows about the coronavirus. In case if you don't know about this virus, here's the introduction that why it is causing emergency in the world. On 30th January 2020, the International Health Regulation Emergency Committee of the World Health Organization declared the outbreak a public health emergency of international concern. Novel coronavirus that was first detected in Wuhan City, Hubei Province, China, and which continues to expand. Chinese health officials have reported thousands of infections with 2019 nCoV in China, with the virus reportedly spreading from person to person in many parts of the country. Infections with 2019 nCoV, most of them associated with travel from Wuhan, also are being reported in a growing number of international locations. Early on, many of the patients in the outbreak of respiratory illness caused by 2019 nCoV in Wuhan, China had some link to a large seafood and live animal market, suggesting animal-to-person spread. Later, a growing number of the patients reportedly did not have exposure to animal markets, indicating person-to-person spread. Chinese officials report that the sustained person-to-person spread in the community is occurring in China. Person-to-person spread has been reported outside China, including in the United States and other countries. In addition, instances of asymptomatic spread of the virus have been reported. Coronaviruses are named for the crown-like spikes on their surface. There are four main subgroupings of coronaviruses, known as alpha, beta, gamma, and delta. Human coronaviruses were first identified in mid-1960s. The seven coronaviruses and that can infect people are 22.9E alpha coronavirus, NL63 alpha coronavirus, OC43 beta coronavirus, HKU1 beta coronavirus, MERS-CoV, the beta coronavirus that causes Middle East Respiratory Syndrome or MERS, SARS-CoV, the beta coronavirus that causes Severe Acute Respiratory Syndrome or SARS, 2019 Novel Coronavirus, 2019 nCoV. People around the world community get infected with human coronaviruses 229E, NL63, OC43, and HKU1. Sometimes coronaviruses that infect animals can evolve and make people sick and become a new human coronavirus. The recent examples of this are 2019 nCoV, SARS-CoV, and MERS-CoV. Middle East Respiratory Syndrome coronavirus or MERS-CoV was first reported in Saudi Arabia in 2012. It has since caused illness in people from dozens of other countries. All cases to date have been linked to the country in or near the Arabian Peninsula. SARS-CoV, Severe Acute Respiratory Syndrome coronavirus. SARS-CoV was first recognized in China in November 2002. It caused a worldwide outbreak in 2002 to 2003 with 8,098 probable cases, including 774 deaths. Since 2004, there have not been any known cases of SARS-CoV infection reported anywhere in the world. 2019 Novel Coronavirus. On January 9, 2020, the World Health Organization reported that a novel coronavirus was identified by Chinese authorities. The virus is associated with an outbreak of pneumonia in Wuhan City, Hubei Province, China. Symptoms and complications. For confirmed 2019 nCoV infection, reported illness have ranked from people with little to no symptoms to people being severely ill and dying. Symptoms can include fever, cough, shortness of breath. Transmission pattern has much is unknown about how 2019 nCoV, a new coronavirus, spreads. Current knowledge is largely based on what is known about the similar coronaviruses. Coronaviruses are a large family of viruses that are common in many different species of animal, including camel cats, and bats. Rarely, animal coronavirus can infect people and then spread between people, such as MERS and SARS, and now with 2019 NCOV. Most often spread from person to person happens among close contacts. Person to person spread is thought to occur mainly via respiratory droplets produced when an infected person coughs or sneezes, similar to how influenza and other respiratory pathogens spread. These droplets can land in the mouth or nose of people who are nearby or possibly be inhaled into the lungs. It's currently unclear if a person can get 2019 NCOV by touching a surface of or object that has the virus on it, and then touching their own mouth, nose, or possibly their eyes. Typically, with most respiratory viruses, people are thought to be most contagious when they are most symptomatic. With 2019 NCOV, however, there have been of spread from an infected patient with no symptoms to a close contact. It's important to note that how easily a virus spread person to person can vary. Some viruses are highly contagious, like measles, while other viruses are less so. So there is much more to learn about the transmissibility, severity, and other features associated with 2019 NCOV, and investigations are ongoing. All travelers from China, including business travelers, people who visited friends and family, and humanitarian workers, should take the following steps. First, watch for any changes in your health for 14 days after leaving China. If you get a fever or develop a cough or difficulty in breathing during this 14-day period, avoid contact with others. Call your doctor or healthcare provider to tell them about your symptoms and your recent travel. If you are sick with 2019 NCOV, you should follow the further steps. You should not leave your home except to get medical care. Do not go to work, school, or public areas, and do not use public transportation or taxis. Separate yourself from other people in your home. As much as possible, you should stay in a different room from other people in your home. Also, you should use a separate bathroom if available. Call ahead before visiting your doctor. Before your medical appointment, call the healthcare provider and tell them that you have or are being evaluated for 2019 NCOV infection. This will help the healthcare provider's office take steps to keep other people from getting infected. You should wear a face mask when you are in the same room with other people and when you visit a healthcare provider. If you cannot wear a face mask, the people who live with you should wear one while they are in the same room with you. Cover your cough and sneezes. Cover your mouth and nose with a tissue when you cough or sneeze, or you can cough or sneeze into your sleeves. Wash your hands often and thoroughly with soap and water for at least 20 seconds. You can use an alcohol-based hand sanitizer if soap and water are not available. Avoid touching your eyes, nose, mouth with unwashed hands. Avoid sharing household items. You should not share dishes, drinking glasses, cups, utensils, towel, bedding, or other items with other people in your home. After using these items, you should wash them thoroughly with soap and water. Monitor your symptoms. Get medical care quickly if your illness is getting worse. Example, if you are having trouble in breathing, call the healthcare provider ahead of time and tell them that you have or are being evaluated for the 2019 NCOV infection. This will help the healthcare provider's office take steps to keep other people from getting infected. Avoid contact with pets and other animals. Do not handle pets or other animals while sick. Although there have not been reports of the pet or other animals becoming sick with 2019 NCOV, several types of coronavirus can cause illness in animals and spread between animals and people. Until we know more, avoid contact with the animals and wear a face mask if you must be around animals or care for a pet. Not with your hands while coughing or sneezing. Avoid contact with others. Not travel while sick. Cover your mouth and nose with a tissue or your sleeves. Wash hands often with soap and water for at least 20 seconds to avoid spreading the virus to others. Use an alcohol-based hand sanitizer that contains at least 60% alcohol if soap and water are not available. There is currently no vaccine to prevent 2019 nCoV infection. The best way to prevent infection is to avoid being exposed to the virus. However, as a reminder, wash your hands often with the soap and water for at least 20 seconds, especially after going to the bathroom, before eating, and after blowing your nose, coughing, or sneezing. If soap and water are not readily available, use an alcohol-based hand sanitizer with at least 60% alcohol. Always wash hands with soap and water if hands are visibly dirty. Avoid touching your eyes, nose, mouth with unwashed hands. And last, I would like to pray for those who are suffering from this disease and hope this disease get eradicated soon. So how did you like this video, and if you have any questions, please ask me. I would love to answer those questions. And if you haven't subscribed my channel, please subscribe to the channel to see more videos like this. And thank you for your support, and thank you for watching this video. Hope this would help you. See you soon. Stay happy, stay healthy. Bye bye.